you so much for being here. I'm really honored to be speaking at this event today about something that I find so compelling as cardiovascular health. It's compelling for so many reasons. Being a woman, being a mother, and being a healthcare provider in the field of cardiology. So we know that cardiovascular disease is one of the leading causes of illness and death in this country, and a lot of it is preventable. So if I told you that there was something that you could do to lower your risk of heart disease, diabetes, and cancer, would you do it? Yeah. The answer seems obvious, but what does that mean exactly? So we know that increased cardiovascular disease, physical inactivity is actually attributed to increased cardiovascular disease, and this is the number one modifiable risk factor. So this is within your control. We know that being physically inactive confers about a 20 to 30% increased risk of death. Wow, that's pretty striking. And that by being physically active, you could actually lower your risk of death by a substantial amount. Consider the following phrase, that sitting is the new smoking. Yeah. So that was a phrase that was coined by Dr. James Levine at the Mayo Clinic. He also happens to be the inventor of the treadmill desk, which sounds like a great idea. But there's a lot of truth to this idea. Sitting has actually increased from 55% to now 58% since 2005. And that's pretty striking. By eliminating this behavior, you can actually increase your life expectancy by 5 to 12 months or even more. We know that by being physically active, you have a 30 to 40% lower risk of cardiovascular disease than by being physically inactive. Let me just repeat that because that was really important. You have a 30 to 45% lower risk of cardiovascular disease if you're physically active. So why aren't we being more physically active? Or maybe we are. Maybe you're good. So that's good. But let's address some of those barriers, why people might not be as physically active. One of the first questions I ask all of my patients is, what are you doing for physical activity these days? And a lot of the time, the answer that I get is nothing. And then I get a nervous chuckle, so I rephrase my question, well, what is the most physically active thing that you can do? And this allows me to understand a little bit more about where my patients are coming from. Maybe they don't know that they need to be physically active. Maybe they've already tried something and it's not really working. Maybe it's that they believe that they have to have a gym membership and a personal trainer, and anything outside of that does not count. Maybe they don't feel good. Maybe they're having chest pain or shortness of breath or joint pains. If they're having some of those symptoms, those are certainly things that I see in a lot of patients, and one would think about getting a stress test. But it helps me understand a little bit more about where is this individual in realizing that they need to be more physically active in their daily routines. Some of these are perceived barriers. In addition to that, lack of perceived enjoyment, companionship, concerns about safety, misconceptions about the type, duration, intensity of physical activity. These are all other known barriers for why people are not more physically active. So what does physical activity actually do from a cardiovascular perspective? Well, it does a lot of things. We're going to go through a huge list of these, but one of them, importantly, it lowers cholesterol. It lowers triglyceride levels. It raises HDL, or good cholesterol levels. It lowers LDL. It stimulates enzymes to remove LDL, or bad cholesterol, from the bloodstream, get it put into the liver for processing into bile, which then gets excreted into the gastrointestinal tract. It also increases the size of cholesterol and protein particles, which makes them bigger and less likely to lodge into small blood vessels and cause circulation problems down the road. It's helpful for improving weight. Physical activity actually decreases the secretion of ghrelin, which is a hormone released by the gastrointestinal tract, which stimulates appetite. It helps to improve blood sugar and improve insulin sensitivity. A single bout of physical activity can actually make your body more sensitive to insulin for about 16 hours, which is incredible. And that's probably because of the fact that by being physically active, you're depleting your body's own natural stores of energy. It helps to lower blood pressure. You have to be doing regular physical activity for about 1 to 3 months to really notice this effect, but it's pretty important. It reduces platelet aggregation. Platelets are these small fragments of blood cells that that stick together and form little clumps and blood clots when you actually need a blood clot. But this is something that we get very concerned about in someone with cardiovascular disease, which is oftentimes why we put patients on aspirin. There is a modest improvement in lowering your risk of developing cancers: breast cancer, GI cancer, colon cancer, prostate, pancreatic cancer, to name a few. There's a reduced risk of rhythm abnormalities. It can reduce osteoporosis and fractures. It can help someone stop smoking. It improves mental well-being, reduces anxiety and depression, decreases the risk of developing cognitive decline and dementia, just to name a few. I mean, there's so many benefits of physical activity. So you might be wondering, well, what should I really be doing in making myself more physically active? Well, the exact physical activity prescription is not really known by anyone. So I can't tell you do this and you'll be good. But what's recommended by the American Heart Association is that we all be basically adhering to about 150 minutes of moderate intensity physical activity, or vigorous intensity, 75 minutes of vigorous intensity physical activity, in addition to muscle strengthening exercises every week. So doing the math, that's about 21 to 30 minutes of moderate intensity physical activity, or 11 to 15 minutes of vigorous intensity physical activity. Moderate physical activity would be something like going for a walk at a pace of 2 to 3 miles an hour, or doing some heavy house cleaning like mopping or vacuuming, maybe playing tennis or light biking. Vigorous physical activity would be something like going for a 6 mile per hour run, or hiking, playing soccer or basketball. And so those are certain kinds of activities that you certainly want to be thinking about. A study done in over 55,000 adults looking at the impact of running over the course of about 15 years and its impact on death as well as death from cardiovascular causes found that over the course of 9 years, patients or people who were running on a regular basis had about a 30% lower risk of death and 45% lower risk of cardiovascular death, so less strokes and heart attacks than those who are not running, which sounds like a lot. But actually, this was even true for people that were only able to do light amount of running for 5 to 10 minutes at a time, and they still actually gained some benefit, conferring an estimated about 3 years more of life expectancy. So that's quite a bit. So how much is too much physical activity? Do we really know that? Well, it's not really known, and this is a little bit controversial, but a study done in over 49,000 females looking at the impacts of physical activity, certainly those that were more physically active had reduced amount of cardiovascular disease relative to those who were inactive, as I've already been saying. But in addition to that, those who were more physically active and reported consistent levels of high intensity physical activity for prolonged periods of time actually had higher rates of cardiovascular disease, cerebrovascular disease, strokes, and even blood clots. So I'm not advocating don't be physically active because you're going to increase your risk. I'm actually saying that really what the American Heart Association is advocating is moderate intensity physical activity more consistently than that, and also incorporating a couple of days of more strenuous physical activity. And so these are certain goals that we can all try to reach in our daily activities. So what if you've already had a stroke or a heart attack, or maybe you're dealing with heart failure? Should you be exercising? Absolutely, yes. And patients that I see that have these problems, I send to cardiac rehab, which is basically a supervised exercise program that's run by highly trained exercise physiologists that watch your blood pressure, your heart rate, and your symptoms while you're exercising and giving you feedback about that. They also give you important information about your medications, your diet, and can provide a lot of very valuable advice to help you achieve a very healthy cardiovascular life. So cardiac rehab is also another option for someone who certainly has already experienced some type of cardiovascular event. I'd like you to just consider all of the facets of your life, your hobbies, maybe sports, maybe it's your daily commute. Where areas can you find to improve your level of physical activity? There was a patient that I saw a year ago, a young female. She was so nice. She came to me, she was smoking at the time, and she said, I'm getting chest pain and I can't walk. I feel really short of breath. And we were really concerned that she might actually have developed some kind of cardiovascular problem. She had smoked quite a bit. So we did a stress test and determined that her heart was actually doing okay, but probably more likely contributing to her symptoms was her smoking habit. So she did a very simple thing. She replaced her 15-minute smoking break with a water break. She got up from her desk, took her water bottle, walked across the building, and walked all the way back after filling up her water bottle, which took her about 15 minutes. So not only was she increasing her level of physical activity, she was also getting rid of a bad habit, the smoking. And I think that this was certainly a very valuable lifestyle change for this person. So consider other things that you can do in your daily activities to increase your level of physical activity overall. The American Heart Association also recommends to follow 7 simple steps to reduce your risk of cardiovascular death by 78%. Those 7 simple steps are controlling your blood pressure, controlling your cholesterol, controlling your blood sugar, having a normal body weight, being physically active, eating healthy, and not smoking. So this is where I find that mobile technology, or mHealth, can be helpful for the individual to meet these criteria. Mobile health is basically what is consumer-level electronics that work with applications to give you instant feedback about what you're doing in your daily habits to increase your level of physical activity and provide you feedback. They can also check blood pressure, monitor heart rate. Some even now can check your EKG and give you information about rhythm abnormalities that you might be experiencing that are important. But mobile technology is ubiquitous. There's hundreds of these devices out there. And myself, I got one 7 years ago. I got a Fitbit. And this Fitbit knew a lot about me. It knew how many steps I was taking in a day. It could estimate how many flights of stairs that I had climbed. It knew how much I was sleeping. It knew so much information. But so what? If I met that benchmark of 10,000 steps, you've heard that, 10,000 steps, take 10,000 steps every day and you'll be fine. Well, what does that benchmark even really mean? Where did that come from? How much is 10,000 steps? Does anyone know? It's about 5 miles. The concept of 10,000 steps was a concept that was popularized with pedometers around the time of the 1960 Tokyo Olympics. And we know that actually by monitoring our physical activity and monitoring our steps, one actually increases their physical steps or their step count by about 2,500. So, maybe that's pretty good to monitor how much you're doing. So maybe you increase it beyond that goal. So 10,000 steps is not necessarily you have to get this and you're good. It's if you're not meeting 10,000 steps, maybe work up to that. If you're already exceeding it, maybe see if you can do even more. Mobile technology is certainly not the answer for everything. There's so many components that go into cardiovascular health, controlling blood pressure, controlling blood sugars, and how a little device can tell you how to do all of those parameters and be in perfect health is complicated. I don't know that a device alone at this point in time is sufficient enough. But where I find that a device could be helpful for the individual user is if it's allowing you to be more mindful about how much physical activity have you accumulated in the day. Have you really kind of just been sitting around all day, or have you been going up and down the stairs? Have you been walking around throughout your day? Are you focusing on trying to be more physically active? And so this is where I think that technology can be helpful. I'd like to conclude with a personal story. 3 years ago, I had my son, and I knew that this very important person in my life needed his mother to be healthy. And I needed to be healthy not only to set a good example for my son, but also to be around in his life for a long time. And so I said, well, he wasn't going to have any junk food and sugar, so I'm not going to have any junk food and sugar. And I pledged to give him the best nutritious food that I could find for him so that he could grow and thrive and really be this wonderful person that I know that he is. And so I had to do the same for myself. And he loves to run. He loves to be outside and play on the playground. And I hope that he always keeps that level of enthusiasm to be physically active. That's just part of his personality. So I pledged to keep that part of his life. So I have to keep that part of mine. And we're all very busy. I know that we have a lot of obligations. But all I can really devote in my own day is about 20 to 30 minutes of physical activity. So if I've been rounding around in the hospital, seeing patients on multiple floors, I use the stairs. When I get to work, I use the stairs. The desk in my office is actually being replaced with a standing desk, just in another effort to help me be more physically active. If I don't meet that benchmark of 20 to 30 minutes in a day, sometimes I go on a walk in the afternoon with my family, and sometimes that alone helps me get up to another make sure that I'm still being as physically active as possible. So in conclusion, set a goal to move more, sit less, get feedback about how you're meeting that goal. Maybe that's with mobile technology and understanding how many steps you are taking in a day. Keep in mind that sitting is the new smoking. We are all important. And set a good example for your family. Taking your cardiovascular health very seriously is of the utmost importance and something that I think that we should be doing a better job of in general. Knowing that this is just such a wonderful group to be here today, I want to say thank you for your time and attention, and I hope that you've taken away with my presentation just a little bit more information about how you might be able to incorporate more physical activity into your life. Take your physical activity seriously. Thank you so much.